One is lifestyle modification. Most of the times, little bit of modification in your lifestyle can do a lot of wonders. Some people have the habit of drinking a lot of water late in the evening. So these are the people, if they modify their water intake schedule, if they do not drink too much of liquids late in the night before going to sleep, they may not have the nighttime frequency. So their lifestyle may be improved by that. Equal good spacing of water intake throughout the day. And there are other treatments option, that is medicines. So previously the medical treatment, because for the prostate, have a lot of side effects, but nowadays the latest medicines are effective, very rapidly acting, and the side effects are also very, very less. Medicine relaxes the prostate capsule. It improves the flow of urination, and there are some medicines which can decrease the size of the prostate also. In the longer run, patient may get away without the medicines also. There are a group of people where there's not much of an improvement in urinary flow or relieving of the prostatic symptoms despite medicines. So these are the group who have to be considered for surgical treatment. So there are other group of people where there are complications because of the enlarged prostate, like they have got total urinary obstruction, they are not able to pass urine and they need to put a catheter, and the medicines are not helping, so they need surgery. Or the group of people who develop bladder stones, the group of people who have recurrent urinary tract infections because of the prostatic enlargement, or patients where there is bleeding in urine because of prostatic enlargement, the people where there is deterioration of the kidney function. The kidney function starts deteriorating in these group of people because of the prostatic enlargement. So these are the group of people who have to be taken up for surgical treatment. So the surgical treatment I want to impress upon is that has undergone a sea change in last maybe 20-25 years. Previously, a person who had to undergo a prostate surgery, there used to be a big incision, big cut in the lower part of the abdomen, and the prostate surgery would take many hours to complete, and there would be a lot of bleeding also, and the recovery period used to be many days. Nowadays, over the last 10 to 15 years, the miniaturization of instruments and the endoscopic and camera usage has revolutionized the prostate surgery. There is no cut from outside, there is no stitch outside. All the surgery is done only through the urinary passage by using a very thin endoscope, which has special instruments for removing the prostate from the inside only. It cores out the prostate gland from inside. Like from the urinary passage, the endoscope goes and it removes the prostate gland from inside. So as the passage becomes all open. And the procedure, the surgery, it takes around 45 minutes to 1 hour's time, and most of the times. And the methods of doing the surgery are many. It's endoscopic, it's done from the urinary passage only, but it can be done by using electrocautery, the traditional way of doing the prostate surgery, which is called as TURP, transurethral resection of prostate. And there are other modalities also, like lasers or bipolar cautery, which have come lately. Lasers can be holmium laser or KTP laser or even thulium laser. So there are multiple modalities for resecting the prostate gland. The idea being that there should be less bleeding, it should be safe for the patient, and the amount of prostate gland which is removed should be maximum. So the post-operatively patient has to be on catheter, the tube which is used to drain the bladder for first few days, and after the catheter is removed, the patient can be all to himself. The urination is good. He may have some burning in urine, some little blood in urine, or little bit of urgency, decrease in control of urination for few days, which automatically settles in just a few days' time. Almost nothing, except that he has to avoid straining. He can move around on the very next day of surgery. He can resume his activities in 2 to 3 weeks time, and most of the times the patient remains absolutely all right after the procedure. So in a nutshell, I would say that prostate enlargement is nothing to worry about. It's a normal, natural process of aging, and usually the symptoms start around 55-60 years of age. And if the prostate is causing symptoms, which I enumerated earlier, then the patient should visit a urologist, do the proper evaluation, which may include some tests like ultrasound or a flowmetry test or some basic urine and blood tests. And after the proper evaluation, patient may be offered the option of medical treatment, and if medical treatment is helping him, well and good, or if medical treatment is not helping or there are some complications, then patient can undergo a very safe endoscopic surgery, which the recovery time is total recovery and rehabilitation might take 2 to 3 weeks time, and after that patient is absolutely all right for rest of his life. So that's it. Thank you.